And now there comes the question, what is TMJ or TMJ disorder? TMJ is the joint, okay? Temporomandibular joint, right here. And it's that gets beat up when you clench and grind your teeth. With no food in the mouth, nighttime or daytime, and it starts to break down. The muscles can get to be pretty tense, and people can get to pretty high suffering points if they don't stop. Some people start out when they're kids, and they start clenching and grinding their teeth. This is the main cause. You can have trauma to the joint, from getting hit in the jaw or falling down and running into a door, whatever, on the edge. But, and that will also damage that. But that can also set up something that'll you start grinding your teeth. You can call it a stress disorder, okay? And the more stress you have, and if you have this habit going, the more you'll break it down, the quicker it goes. Nutrition can add to that or subtract from it, rather, and certain things like stimulants, like too much caffeine and sugar, will make you do even more too. The biggest thing is you have to stop this clenching and grinding, so that this degenerative process stops breaking down both the teeth and the TMJ. Now I've been doing TMJ treatment for over 50 years, and it's been highly successful. We have, I think it's pretty universal that we have a perfectionist inside us, okay? That it drives this jaw motion, and it's part of our stress system response. And when the stress system gets activated, this starts overworking. And that's usually because our bites are off, are unbalanced. So one of the things you want to avoid is to have your stress system fix your bite, because it's not a good fix. I give my patients, when I see what they're going on through, a perfect bite artificially with an appliance worn on the lower, invisible, can be worn anytime, but you really only have to wear it at night. And it does its magic, because the stress system is oriented to fixing things that are wrong from its point of view. And when you get a perfect bite, the stress system has lost its motivation to help us, which is a good thing, okay? You just all of a sudden aren't doing it so much, and your muscles start to relax. And it takes maybe one other adjustment after you get this started, because what happens, the bite changes when your muscles start relaxing. And then you go do an adjustment again, and then you find out, and sometimes that's the last one or one more adjustment, and then it stays, because now you're not doing this terrible habit. I can either equilibrate, or sometimes you need to have a little dentistry done to get the bite established and to be more perfect and stable in the ideal position of the jaw. Some people it's not a hard fix, and some people it's rather amazing what they have been living with. But that's what you have to make a decision about, because otherwise you'll need to wear that appliance at night routinely, and just make sure it doesn't break down after years or months or years, okay? So if you're struggling with pain or arthritis, or your jaw aches, or you find yourself holding your teeth together an awful lot, I would suggest you to come in and let me take a look and see what I can do for you, and I'll help you out. This is a relatively low-cost program. It can be a permanent fix, okay? That's a big deal. I really love to do those, okay? Thank you.